It's my honor to share with you today. So my topics today is your works and promoting dementia inclusive language and change of perception in dementia care in Hong Kong. It's my honor to attend the 31st Alzheimer conference, and my name is Kenny. So regarding this topic, actually, we found out that the stigmatizing attitudes towards the mental and related disorders have long been a significant factors in mental health policies in Hong Kong. It is commonly used demented patients or sufferers, wandering, burden, etc., to describe people with dementia in the working context in Hong Kong. The particular terms were directly translated into the Chinese or Cantonese words with a very negative connotation. Therefore, the awareness we've joined the Dementia Alliance International and the inspiration of Ms. Kate Wolfer, the co-founder of the DAI, a qualitative research with in-depth interviews among dementia and frontline care staff in Hong Kong was done to understanding the Chinese terminologies of dementia care. The findings show that the use of the language would affect the self-perception of people with dementia and the perception of care practitioners. With the back translation of the Chinese term in Hong Kong, people with dementia were being labeled as a madness, insane, troublemaker, naughty child, desolated person, confused one, and the sufferer, etc. Regarding the unmet needs of the people with dementia, their responsive behavior was identified as the over-demanding and the psychiatric symptoms. By highlighting how the medical perspective on dementia denies the importance of taking the subjective views of people with dementia into account and empathizing with their self-perceptions. This research showed how focusing on their physical care at the expense of their emotional needs can undermine their quality of life. So the right-hand side demonstrates the Chinese translations of a better, or what we call the dementia inclusive language. You can take a look. So therefore, a paradigm shift needs to occur in the care model and the policy for planning dementia care services in Hong Kong in response to that problem. Against those stereotyping and generalizations, public educations and the training should be organized to focus on the perspective of people with dementia and their rights to speak out and be heard. With the reference and the support of the Dementia Australia, a Chinese version of dementia language guidelines was developed in Hong Kong. Undoubtedly, the government should stop validating negative perceptions of dementia and people with the condition, but instead stress the importance of person-centered care in a dementia inclusive approach in dementia care services. And same with the previous slide, the right-hand side is another one that the Chinese translations is page 2, translated by me, and with the support of the Dementia Australia. If you are interested in the Chinese translations of the dementia language guidelines, please contact me later on. So as a conclusion, because of time, we would like to promote the terms dementia, the proper caring attitude to people with dementia. So in our mind or in my research, we are finding that is it person with dementia could not do something, or a person with dementia could not say something to us, or a person with dementia could not express themselves, or actually the people with dementia were not being trusted. The people with dementia were not being invited to be shared, and also the person with dementia were not being respected. So overall, we need to think over and have a very good reflection about, is it a matter of meaningful engagement to them, but not being engaged only. We are not just giving something for them to do, but meaningless. It's a matter of living, but not a matter of lives only. They need their life. Maybe they need more meaningful engagement. Therefore, it's a matter of living, not just only the basic need. And last but not the least is talking about it's a matter of caring, but not a matter of care only. So we are not just only provide the nursing care or medical care, but we need to have the holistic care to consider the whole person, how we can do better and design our dementia care services. So thank you very much for your hearing or listening. If you have any questions or if you have anything that would like to share, please contact me and I will try to leave my contact in the first slides. Thank you very much.